I want everyone in the room to reach into your pocket or your purse. Take out that phone. I know it's in there. Come on, take it out. Once you've got it, hold it in your hand. Have a look at it. Turn it over. What are some of the thoughts that cross your mind? Why hasn't she texted me back yet? Oh, quick, status update. I really wish this was a new iPhone. Sometimes I wish I had just switched this thing off and leave it at home. Well, tonight, ladies and gentlemen, I want to show you how this marvellous piece of technology, because it truly is marvellous, is in fact a life-saving device. Just over 10 years ago, I was in Vietnam, in Hanoi. I was there as part of a project to connect local doctors with doctors from Australia so they could discuss difficult medical cases over the internet. The premise was simple. By providing access to a computer, the internet, and a digital camera or a scanner, we could close the so-called digital divide between doctors in developing countries and developed countries. The setup looked something like this. Yeah, the computers look funny. It was pretty basic, right? But for 2002, I can tell you this was cutting edge. I still remember the feeling in the room that day. For many of the doctors from Vietnam, this was totally new. The internet wasn't a thing. Many didn't have personal email accounts. And a digital camera was a luxury item that was unaffordable to most. At the time, I was a young guy with a degree in IT, and I'd been working overseas building websites. I was there with a good friend of mine, Dov, a medical student at the time, because we shared a simple vision, that technology, if applied well, could improve the lives, could improve the quality of healthcare, and make a difference to people's lives in a positive way. We were young, we were passionate, and we were living the dream. But back then, there were some pretty big challenges. Recognise that sound? Technology was slow, it was expensive, and it was foreign. A lot's changed since then. I've had a haircut. I've realised every Jewish mother's dream and become a doctor. The internet has pervaded pretty much every aspect of our lives. And I can bet you that that phone in your pocket or your purse is more powerful and has more features than the computers that we were using back then. Well, around the world, things have changed too. The spread of mobile technology in just the last 10 years has been at a pace that is absolutely unprecedented in history. Today, there are over 6 billion mobile phone subscriptions. And the biggest change has actually occurred in developing countries, where they've effectively leapfrogged traditional fixed lines. We are connected like never before. 90% of the world is covered by basic cellular access, which means that people can make a phone call or send a text message. And these networks are rapidly expanding to provide other services like internet access. Over the same time, I've been to many developing countries, and the same picture emerges time and time again. Healthcare is very, very basic, unrecognisable to you and me. There are scarce resources available, and especially there's very little for people with NCDs. But everywhere you go, there are mobile phones. For the first time in history, we can bring healthcare to people, even in the most remote corners of the world. And this is what we call mHealth, and this is why it's such an exciting thing. Now, I'm not standing here to tell you that a mobile phone makes up for the lack of sanitation, clean water, or electricity that so many people still go without. Technology itself is not a silver bullet, but it's a powerful enabler. And we need to embrace it and understand how to use it to make healthcare better and equitable for all. So, here I am, a doctor passionate about global health, using technology to improve access to care. And I'd like to share with you just 3 simple examples of how we're doing this, specifically for NCDs. Now, we've heard a lot tonight about different NCDs, and there's lots of different conditions. And I'm going to talk about heart disease. I'm going to talk about how we could potentially prevent heart attacks and strokes, and by doing so save millions of lives and prevent lots and lots of suffering. You heard from some of our speakers about behaviour change and how a lot of the risk factors for NCDs are shared. We need better prevention, and this really comes down to changing people's behaviour. So whether it's trying to get someone to stop smoking, whether you want them to eat better food or exercise more, I can tell you that this stuff is really hard to do. So a really simple but effective use of technology, and something that can be done on a device just like this one, is text messaging to help people quit smoking. It's simple. And it works pretty much like this. You sign up for a service, you get a text message, a motivational message to help you to achieve that goal of giving up the ciggies. Now, we all know this can be hard. People relapse, people kind of have cravings. Well, with this type of a system, you can send a message back when you're having a rough time or when you've had a slip up, and it'll send you back some tailored response to help you keep on track. Smart workers. Now, this is something that I'm particularly excited to share with you because it's a focus of our work at the George Institute for Global Health. And it comes back to some of those best buys that Kate talked about earlier. If we could better identify people who are at risk of having heart disease and intervene early by either encouraging them down the behaviour change path or really getting them onto very simple, cost-effective medications, we could make a huge difference to preventing heart attacks and the suffering that goes with it. And as we've seen with healthcare resources as they are and the situation in developing countries, this is particularly challenging. This is a picture of a community health worker in rural India. She's most likely a woman with a high school education, and today is at the front line of providing healthcare in her community. With a tablet just like this one, she's able to practice evidence-based care and identify people's risk of developing heart disease. A clinical algorithm that's been developed and packaged up as an app guides her through this process step by step. If at the end of it she identifies someone who's high risk, she can refer them on to the clinic and the doctor can see them and prescribe medications if it's required. So here she is, providing a vital bridge between the community and the clinic in addressing the growing burden of NCDs. And finally, to the future. Now, unfortunately, we can't prevent every heart attack or stroke. And for those people, lifelong medication is vital to prevent another one. Now, you're saying, well, that sounds easy. Just take a pill. But in fact, it's really hard, and it's one of the biggest challenges in healthcare today. So what if there was a pill box that would remind you when it was time to take your meds? Well, there is. This pill box is a bit confused. It's actually part mobile phone, part pill box. It's got a SIM card built right into it. So it knows when your medications are due and can track whether you've taken a pill out of the bottle. It can do all sorts of things to prompt you. It can play a funny noise, it can change colour, it can vibrate. It can even send you an SMS or an email, or in fact, call you up. And if it's noticed that you haven't taken a couple of pills and it gets really worried, it'll tell on you to your doctor or family member. The world, in a word, is going mobile. When I look back over the last 10 years, I'm astounded by just how fast and how much things have changed. But there is still a long way to go. 4 billion people don't have access to the internet. And even more than that, lack access to regular, quality healthcare. Imagine if we could harness technology to close this gap once and for all. And we will. I'm more confident than ever. This revolution is just beginning. Thank you.